Hello. Good afternoon, and thank you for joining us. General Matt Quinn, Executive Director of the COVID Task Force, is also with me here today. This afternoon, we'll provide you with a brief update on our progress we're making to confront the COVID pandemic. And Montanans continue to make great progress. After a brief surge at the first of the year, our confirmed cases continue to trend down with 243 new cases today. That's 85% fewer than we were seeing just in mid-November. And our hospitalizations continue their downward trend as well, with 91 today. And I want to note, this is the first press conference we've held where hospitalizations are under 100. While we aren't out of the woods yet, we continue to make progress and our trend lines remain promising. But it's just not about our positive trend lines as far as new infections and hospitalization. It's the positive progress we're making in getting shots of safe and effective vaccine into the arms of Montanans. As of today, Montanans have administered nearly 190,000 doses, and more than 55,000 Montanans have been fully immunized. Just who are among the 135,000 Montanans who have received at least one dose? There are frontline healthcare workers who have been treating the sick and getting shots into arms. There are most vulnerable, folks living in long-term care facilities and assisted living facilities. Seniors, 70 years of age and older. Montanans, 16 and older with severe underlying health conditions like cancer and heart disease. Native Americans and persons of color who are at elevated risk with severe complications should they contract the virus. We are saving lives with this approach by putting our healthcare workers and the most vulnerable at the front of the line for vaccinations. But that takes us back to a familiar and frustrating refrain. We're not getting our fair share of vaccines. On January 28th, I asked President Biden to increase vaccine production and to send more doses to Montana. At the time, we were successful in getting the vaccine effectively and efficiently to the most vulnerable. But we ranked 45th in the nation in terms of vaccines allocated per capita by the federal government. We aren't getting our fair share of vaccines. Unfortunately, our federal allocation continued to lag. About 2 weeks later, I again asked President Biden to increase our vaccine allocation. At the time, we continued to effectively and efficiently get shots in arms. But again, we ranked 45th in the nation in terms of vaccines per capita allocated by the federal government. We still weren't getting our fair share of vaccines. When I reached out to President Biden, I let him know that we can administer half of our weekly allocation of first doses in one day. And we've done it. The problem remains that we aren't getting our fair share of vaccines. I let him know that we're prepared to administer 3 times as many vaccines as we're getting in a given week. We've proven time and time again that Montanans are doing a better job than so many other states, that we're not wasting vaccines or letting them sit on the shelves. And yet, we continue to be about 45th in the country in terms of vaccines per capita allocated by the federal government. We have a Montana success story with vaccines, but the federal government fails to get us our fair share. And I want to take a minute to thank Senator Daines, Senator Tester, and Congressman Rosendale for joining me in bringing this to the attention of the Biden administration. Last Friday, I traveled to Kalispell and Polson to see firsthand the success of our vaccination clinics, our MaxVax sites, and the result of our successful efforts to have unused federal vaccines redirected to Montana for distribution. In early February, we secured approval from the federal government to redirect almost 20,000 unused doses of of vaccinations to our most vulnerable Montanans. The clinics in Kalispell and Polson, nurses and healthcare workers were administering these vaccines that we secured through this reallocation. In Kalispell, they used 1,000 of the unused vaccine doses just last Friday. I talked with seniors who had just gotten vaccinated, who shed tears of joy because of the fear that had been lifted from them. Volunteers were assisting fellow Montanans getting the vaccines. Individuals who had just received their vaccine were asking how to volunteer so they could help others. In both Polson and Kalispell, the clinics were running like clockwork. Volunteers were working together. Honestly, it made me proud to be a Montanan. Neighbors were helping neighbors. It was the largest clinic healthcare officials in Flathead County have done to date. And a nurse told me it's possible for them to do 3 times more than what they did on Friday. We have the infrastructure in place, and our counties are sharing best practices between themselves with each other so they can get more shots in arms as quickly and as effectively as possible. We'll get through this pandemic with everyone working together and neighbor helping neighbor. Let me close by saying there is one upside to our consistent efforts to wrangle more vaccines from the federal government. When I reached out to President Biden last Friday,
line unmuted,
I mentioned not only that Montana wasn't getting our fair share, but also that Montana had been left out of his administration's new federally qualified health center COVID-19 vaccine program. The new program starts this week, but Montana wasn't on the list. I pressed the administration to get Montana on the list, and yesterday, the administration added Missoula County Health Center to the program. I appreciate the Biden administration's responsiveness to that request. I hope the Biden administration will also listen to our request and that of our bipartisan congressional delegation to get Montana its fair share of the vaccines. We've proved that we can get them in arms, and we've earned our fair share of the federal allocation. With that bit of good news, I'll be happy to take your questions. Yes, Ivy.
Hi, Governor. Thank you for taking the time today. This is Iris Samuels with the Associated Press. And my first question is, at the current rate of vaccination, when do you expect Montana to enter the third vaccination rate, and who will be in that phase?
Yeah, so we are encouraged by the vaccinations. We're getting close to 200,000 doses administered. We share on our website very good transparency on where those vaccinations are going and who's been covered. We still have a ways to go to get through the 1B category to make sure the vaccines get to the most vulnerable. We're going to work through that and then use the facts available to us to make the best decisions so that we can continue to protect our communities. Do we have a question online? Okay. Yes.
Governor Gianforte, John Riley with Montana Television Network. This is just me doing some simple math, but Montana just hit about 5% of our population vaccinated, and we're into the middle of February. Is it concerning that we're not able to get enough of our population vaccinated? And looking at current, numbers, we might not see that 70% till the later of the end of the year or even next year.
Well, John, I'm encouraged by the modest increase in productions that have occurred. I would also note that we expect that this Johnson & Johnson vaccine will be approved later this month, hopefully available here in March. And in our conversations with the pharmaceutical executives, we expect production to ramp up quite a bit in March. So I would not just extrapolate off current numbers. I think we'll be seeing additional allocations going forward. And certainly that's what we're asking the Biden administration to do, is just get Montana our fair share.
And to follow up to that, Governor, has the Biden administration responded to your request? Have they directly said why Montana isn't getting that fair share of vaccines?
I've had one-on-one conversations with people in the White House about this on multiple occasions. We do not have clarity on how the allocations are being done or why Montana lags most of the other states in the country on the per capita allocation. We'll continue to press them because we've proven we can get shots in arms, and this is really the light at the end of the tunnel that is going to make life brighter for all of us. Any other questions? Oh, we do have one online. It's kind of a soft question.
Hi, Governor Gianforte. This is Marisa Giorgio with NBC Montana.
Hi, Marisa.
I apologize. We couldn't hear the first part of the press conference on the phone call, but if I missed this, I apologize. But I'm wondering, with the Federal Qualified Health Center COVID-19 vaccine program and the announcement you made yesterday about Missoula County being selected to receive vaccines through that program, is there any clarity today on quantities, like what exactly that means going forward?
Yeah, I'm looking at General Quinn here. We do not have clarity on quantities going through that program. This has been a concern that we've expressed to the Biden administration. They are setting up, we have existing channels of distribution here in Montana that we've proven. At this point, we have over 90% of the vaccines we've received are in people's arms. We consistently are doing a great job. We really don't need new channels of distribution. We just need to put more vaccines in existing channels. Our advice, myself and other governors around the country, have been back to the Biden administration. Let's use the distribution channels that are working rather than creating new ones which siphon vaccines away from channels that have already been proven. There's a question here?
Yeah, thank you. My question is about an announcement made last week by Dr. Gregholtzman's announcing that he decided to resign effective in April. And I'm wondering if you can share any discussions that you might have had with him regarding that decision, and if that decision will impact in any way Montana's response to the pandemic.
Yeah, I did speak with Doc Holtzman after that announcement was made, and I thanked him for his service to the state. He's been a stalwart. I also thanked him for his willingness to continue working for the state during this period. And I shared, it's been a difficult period for medical professionals given the pandemic. So I thanked him for his service. At no point did he express any oppositions to decisions that our administration has made, and I just appreciate his service to the state. Do you have another question online?
Holly Michaels. Hey, Governor, this is Holly Michaels. Are you hearing me okay?
Yes, I can.
Okay. I had two questions for you. The first one, I was just wondering what sort of feedback you've heard from county health officers around the state after the lifting of the statewide mask mandate last Friday.
Okay. So we've had conversations. I've had conversations with public health officials. We did up in Kalispell and in Polson as well. The fact that we left the authority with the local folks, small businesses, they can make decisions for themselves, is really an implementation of the strategy that I articulated throughout, that I think we need to move to more a system of personal responsibility. Authority remains with these local health boards to make decisions based on what they think is best for the community, but a one-size-fits-all, centrally controlled, impractical set of mandates really don't serve our purposes, especially with the downtrending in the cases that we're seeing. Do we have another?
And then I wanted to ask you about a piece of legislation that's moving through the process. It's Senate Bill 100 from Senator Terry Smith. It's looking at how people are qualified for Medicaid in the state. And I know that during the campaign you talked about wanting to make sure that people who are on the program were properly qualified. And I wanted to ask if this is legislation that you and your staff have engaged on at all, and if this is something that meets what you were hoping to achieve.
Yeah, I'm not familiar with that particular bill. I mean, there's a lot of bills moving through the legislature. We'll take a look at them if they get to my desk, and we'll make the best decision in the interest of Montana. Yeah, another one online here.
Speak to Governor, can you hear me now?
Yes.
Zach Kaplan from Montana right now. I know there are bills that seek to limit some of the governor's power in a state of emergency that are being drafted through the legislature as well. I know there's a couple of different ones, but I'm wondering if you have had an eye on them and if there's any concern from you at all, just whether it's a pandemic or fire season, just the power that it would potentially take away from the executive branch of the state government. Thank you.
Yeah, thanks for the question, Zach. There are a number of bills moving through. Some we would be supportive of, others not. We continue to have dialogue with leadership, and we'll see what makes it to my desk, and we'll make a decision based on that. I do think it's important. This is a very unique situation we have that has not, occurred in this country in over 100 years. We have to make sure we don't overreact to it, and we need to respect the separation of powers that exists between the executive branch and the legislative branch. But again, there are some reforms there we would be open to, and we'll keep an eye on them as they progress through the process. Yeah, another one online?
From Representative.
Yeah, we can hear you now. Just repeat your name if you would.
Oh, sure. Sorry, it remuted. This is Chad Sokol at the Daily Interlake.
Hi, Chad.
I'm curious about House Bill 257, sponsored by Representative Jedediah Hinkle. And recognizing that it's not on your desk, and recognizing that you don't prefer mask mandates, this bill would essentially nullify all of the mask ordinances in Whitefish and Fort Montana counties as they pertain to businesses. And I'm curious if you agree with that approach in principle.
Yeah, again, I'm not going to comment on legislation that hasn't made it to my desk yet, but we'll take a look at these things. I do think best government is made by local decisions, and that's part of the reason why we transferred the authority back to the public health officials here. Any other questions in the room here? Great. Thank you for being here today. We'll keep you posted.